Hello, everyone. So the Premier of Quebec, Mr. François Legault, together with the Minister of Health and Social Services, Ms. Danielle McCann. Mr. Legault will start speaking. The microphone is off.
On va vous laisser une chance.
Is it okay now? Yes, I can go? Okay. So I had a really good meeting with the Minister of Health and the Integrated Center of the Lanaudière of Health and Social Services, Mr. Gaston. So we try to go over the past 2.5 months. As you know, the situation has been difficult. There were 179 deaths. A lot of people still who have been contaminated, although the situation is very much under control. And of course, as we've seen in a lot of places in Quebec, the main problem was the lack of staff in CHSLDs. Thank goodness, the CIS very quickly transferred employees from the hospitals towards those CHSLDs in order to be able to compensate and take back the reins of the situation. However, a lot of CHSLDs were infected right from the beginning. We know the fact that there weren't very many employees and not very many qualified employees. Some at the beginning weren't wearing any masks, and they were vectors of the virus, and they contaminated residents, many of them. What is also important to keep in mind as well are that certain private CHSLDs, where clearly we agree that there are some management problems. And I think that this reinforces our position of taking greater control over certain CHSLDs that are private. One word, I also had a meeting with union representatives right before the other meeting, and just to let you know that the management team of CIS has come to an agreement with the vacation with the CSN and the APTS. So as Danielle has said, all employees are going to have 2 weeks off, continuous 2 weeks, by the end of September. Unfortunately, we do have still a problem with the FIC. That union requires 3 weeks of vacation. The CIS management has proposed that if we offer the 3 weeks, it becomes mathematical. It's a calculation that brings us to the 13th of October for the vacation period. So unfortunately, the FIQ union requires both the 3 weeks and that it be taken by the end of September. And mathematically, that is impossible. So both offers are still on the table. So 2 weeks of vacation by the end of September for everyone, or 3 weeks for everyone, but until mid-October. So it's a question of continuity of services. And the proposal of the 2 weeks by the end of September was accepted by the CSN as well as the APTS. I have a hard time understanding why we can't agree with the FIQ. So that's all. I don't know if you have any questions.
Vous êtes assez nombreux, donc s'il vous plaît, vous limitez à une question. Suite à votre intervention, il y a du désinfectant pour les mains, donc seulement l'utiliser. Première question, Tristan.
First question. Hello, Mr. Legault. There is Dr. Drouin, who said in an article in La Presse this morning that she thought that the crisis center should have been in Montreal rather than in Quebec City, that it perhaps played a role in the pandemic. What do you think about that? Well, I spoke with the mayor of Montreal, Valérie Plante, this morning, and we were both surprised that that statement was made. I understand that Ms. Drouin said that she wasn't quite correctly quoted. I think that we had really good collaboration with the City of Montreal. I had many good opportunities of speaking with the mayor, and Dr. Arruda, who is the National Director of Public Health, wanted to leave some autonomy to Dr. Drouin. And I have a hard time understanding those remarks because I think that it was very well managed, and honestly, that our crisis cell was in Quebec City or in Montreal, It was in a room. We, of course, followed the situation in all CHSLDs where there were a lot of infections. And I don't think that it would have changed anything that the, room be in Montreal or Quebec City.
Mathieu, pardon.
Mathieu?
Bonjour. Une question. Le Premier ministre...
A question. Prime Minister Trudeau today talked about the possibility for families of letting members of the same family through the U.S. border. Are you comfortable that this be done? How do you see it? Might there be measures to set up if ever the federal government does go forward with such a measure? Well, listen, we have a meeting every week over the phone with the premiers of the different provinces and the Prime Minister. I see that there's like two trends. The western provinces, who are not affected, wish for the border to be opened earlier. And the eastern provinces, amongst Ontario and Quebec, that are more affected, we want to wait a few months still before allowing tourists, for example, to come as a family in Quebec. So we agree to allow essential workers, those who deliver merchandise, to get through the border. But we believe that we should restrain the circulation of families and tourists still for a few months. To come back to Dr. Drouin, she was saying that it seemed to be possible to create a link between all the COs. If we had a second wave, which we don't wish, but if we had one in the second wave, are you going to give Montreal more power to be able to take quicker decisions, or do you say that it's going to be changing nothing to the situation if it's managed in Quebec or Montreal? Well, what we don't want is to add a structure. A lot of people think that we should, add a structure in Montreal to better coordinate the CHU, the CEUS, and the CIS, but there's a role to be played by the Ministry of Health for that coordination. And it's true that it wasn't always easy to convince, for example, the university hospital centers to transfer staff to CHSLDs. The CIS and the CEUS have CHSLDs, CHUs, or the hospital university centers, don't. And at the beginning, we were expecting the wave to really hit hospitals and emergency rooms, but we saw very quickly that it hit CHSLD. So, for example, here in Lanaudière, the fact that there is one CIS that takes care of hospitals and CHSLDs, it allowed to quickly transfer employees from the two great hospitals in Joliette and that of Terrebonne towards the CHSLDs. In Montreal, we are going to have to find a way. And I don't think that it's necessarily a thing of adding structures. Do the CEOs and the CIS and CEUS and the CHUs, maybe they should work more together to send the employees to the correct places. But of course, and I don't miss any opportunity of reminding people of this, we are launching training for 10,000 orderlies who are going to be making $49,000 a year. It starts in mid-June, ends in mid-September, and if we were able in CHSLDs to get all the staff that we need, we know that we were missing 10,000 employees before the crisis. Well, now the question wouldn't be so important to know how we transfer staff from hospitals towards CHSLDs, because everybody would have their own staff. But it has to be recognized, in Quebec, it is a problem that has gone through many governments, all sorts of governments, and CHSLDs have been neglected. So in the future, we have to have more employees, and we have to pay them better. Because CHSLDs are like mini hospitals, basically. There's a lot of care given, so we need qualified people who know, amongst other things, how to wear masks to avoid infecting the residents. So the real solution is that all the facilities have the staff that they should have. And there's work to be done as well for better coordination between the CIS, the CEUS, and the CHUs in Montreal.
Bonjour, M. Legault, François Morin de CFNJ, Lanaudière. On se rend compte
We realize throughout the days that more and more people are getting cured and that there are fewer and fewer active cases. Are this real data, or are we missing tests? No, we're testing a great deal more. We used to test 6,000 people per day. Now we have 14,000 per day, and there's fewer cases. That's good news. So you saw two reports that came out. The the INES and the NSPQ. Both reports have the same conclusion, that there's a lot less community transmission, including the Greater Montreal area and including Joliette, because as you know, we added Joliette to the MMC because there was community transmission that was comparable. Thank goodness, community transmission has been reduced by quite a bit in the past few days and weeks, so that can make us optimistic for the opening of businesses and social gatherings over the next few weeks. Concerning the Joliette area, Dr. Lessard, in an interview, said that he was not satisfied with the screening process in Joliette, the speed at which it was done. It seems that people are not tested enough. He was even saying that it was 2 times less in Joliette than in Terrebonne. It can't be understood what is happening in Joliette to be able to measure the actual problem. Well, we had the same situation that we had for a while in Montreal. We have to convince people of the importance of getting tested as soon as they have symptoms or as soon as they have contact with people who had symptoms. So we test more and more people who have no symptoms. So, of course, we have to test more, but it remains that even if we didn't test as much as we wish to in Joliette, the results of those that we do test are much better than they were a few weeks ago. The situation is going to allow us in the MMC and in Joliette to be able to get to the next stage of deconfinement.
Bonjour, Monsieur Legault.
Hello, Mr. Legault. Yesterday you spoke with Mr. Trudeau. Is there an agreement that the soldiers stay until the 15th of September in CHSLDs? I felt a greater opening, let's say. So we still have discussions to have. I was pretty direct with Mr. Trudeau. I asked him what can be more urgent as other work. There's many issues. The Canadian Armed Forces work 7 days a week, 12 hours a day. I can understand that after a certain number of days they are exhausted and they have to have rest. I suggested that the military staff work like anybody else, 8 hours a day, 5 days per week. But it seems that it's difficult. But I would wish to keep them until the 15th of September because we're going to be training 10,000 people from the 16th of June to the 15th of September, so it's going to be tight. So I would like to keep the 1,000 soldiers. What we also know is that out of the 1,000 soldiers, there is an important percentage of them that are outside of CHSLDs. They do reports. I have nothing against reports. But the ratio, I'd like to see perhaps more out of that 1,000 in CHSLDs. Mr. Legault, you spoke about the fact that generally speaking in Quebec there were 10,000 employees missing before the pandemic, and that since the pandemic there was a further 9,700 people, more people missing. Do you have the numbers for the Lanaudière region? How many employees are there missing right now? There's 700 to 800 employees missing. And I will take advantage of this and I will ask all media in Lanaudière to talk about it. It means that we need to get at least 700 people who feel like, coming to that training to commit in themselves, $760 per week during 3 months from the 16th of June to the 15th of September. And after that, they will make $940 per week, $49,000 per year with all the pension funds and the social benefits. So I sent out a call to all the Lanaudière people. These are good jobs. They're enriching. They're rewarding to help our vulnerable people in CHSLD. So we have 700 missing people.
Il manquerait une question en français, je pense. Oui.
Daniel Yvon, c'était RBTV à Berthierville. Et qu'est-ce que je voudrais savoir?
I would like to know, you were talking about the orderlies, but in the Lanaudière region, paramedicals are also important. What is the situation right now? Well, we know that there was an issue on the question of foreign workers that who usually come here. There are a few that we did manage to get a certain percentage of them again. we offered, on top of the $100 that was already being offered for essential workers, there was a further $100 that was offered to go help people in the agricultural domain. So the young people that want to spend a part of their summer in the fields, on top of the wages that is given by the farmers, that's an extra $200 a week. It's important in agriculture. It's important. They are the ones who feed us, and we want to be as independent as possible. So it could also be jobs that could, be in greenhouses as of next winter. So young people, I call out to you, go help our farmers. You will have a beautiful experience. The interpreter wishes to apologize. I had heard paramedic, but apparently it was farmers.
I know you've spoken
English.
about this just earlier in French, but if you just reiterate in English, did you get any kind of firm agreement or commitment from Prime Minister Trudeau on the armed forces staying until mid-September to help in the CHSLDs?
No, but I felt a better opening from Mr. Trudeau. He said that he would like to discuss that with me soon, and he understands that we need those people until mid-September. I told him that they don't need to work 12 hours a day, 7 days a week. I'll be happy that they work like the other ones, 36 hours a week. He told me that that's not the way it's working in the Army, but maybe we can change that. But I hope and I'm confident that we'll be able to keep them for longer.
Next question is CBC.
Mr. Premier, the province is allowing aesthetic services, haircuts, nails. These are different than other businesses because people have to spend a great amount of time sometimes getting these jobs done in close confinement. What is the urgency for people to get in Montreal to get a haircut or a tattoo when it involves spending so much time in close proximity with people?
Well, I had my haircut done by my wife, but some people don't have a wife with so much skill than mine. So I'm hearing a lot about people who would like to get an haircut. Yes, it's not like Manu. I think it's getting very, very urgent. But I think with a mask, it can be done and without risking of infecting the other people. But both of them, they have to have a mask and wash their hands after.
Thank you. Merci beaucoup tout le monde.
Merci tout le monde. Bon week-end.
Thank you, everyone. Have a good weekend.